ring avulsion because it's not an uncommon injury. People on their ring finger catch something, it just gets stuck and it kind of rips the finger off, and it can be one of the most devastating injuries.
One other thing that happens is when people are walking their dogs or they're leading their horse and they'll wrap the lead or the leash around a finger. This is when it also happens. Don't do that. Don't wrap it around your wrist. Don't wrap it around your thumb because thumb avulsions occur that way as well, and they're very difficult to get back on.
I like to work out. I attend a gym, and we see this all the time where folks will work out with their rings on. And to reiterate what Dr. Treiser and Dr. Lett said, these are traumatic injuries, and they're often not successfully replanted or put back into place. They're very challenging because the ring pulls off and strips all of the tissue. And so I strongly advise folks, if you are going to work out, to take off your rings, and if you insist on wearing a ring, for them to be silicone so that you don't put yourself in that situation.
Whenever you do industrial work, not wearing your rings, I think wearing safety gloves when you're doing industrial work to make sure down here, I don't really see it, but when I was up in training, we used to see patients putting their hands in snow blowers all the time. But down here, we see them putting their hands in lawnmowers. So you got to be careful about equipment, particularly table saws. You just got to be careful. Make sure that the saw is off and don't put your hand anywhere near it, and wear your safety equipment.